According to studies, more than half of all people experiencing alarming cancer symptoms choose to ignore them until it's too late. Here are 13 signs and symptoms you should be concerned about, as disregarding them could lead to death. Number 13. Noticeable skin and mole changes. Skin cancer is not only the most common cancer in the US, but its early signs are also tricky to recognize. Skin cancer is nasty and disfigures you terribly, so catching it early on is important for a good prognosis. Melanoma is a malignant skin cancer that develops from our pigment-producing cells, the melanocytes. They usually develop from moles on our skin, and the most prominent sign of melanoma is a considerable change in the appearance of a mole in terms of shape and size. If it gets bigger, darker, irregular, becomes raised, or if you spot a new mark that appeared almost suddenly, you should definitely see a dermatologist to undergo skin cancer screening. Many people tend to think that their moles, freckles, or age spots are just like others they've had until it's too late. The primary cause of skin cancers is prolonged exposure to ultraviolet light. Those who frequently work under the sun or use tanning devices too often are at risk. Number 12. Sores that refuse to heal. Cold sores in the mouth are normal and are usually triggered out of hiding by stress and fever. Usually they aren't a cause for worry, but if you notice a particular sore that's not healing past the 3-week mark, then go see a doctor. A normal sore would have healed itself by that time. Otherwise, it could be a sign of carcinoma. Other symptoms you should take note of that could indicate mouth cancers are pain that persists, numbness or swelling of the mouth and jaw, and any discolored red or white patches on the tongue or gums. Number 11. Unexpected vaginal bleeding. All women should be aware of the regularity of their menstrual cycles so that they could detect any changes that are out of the norm. Any vaginal bleeding outside of the normal cycle is a cause for concern and could be an early sign of cervical cancer. This also applies to women who have undergone menopause. It is quite common for them to still see some light spotting, but if they start bleeding again consistently like they did before menopause, it could be the early symptoms of cancer of the uterus. The good news is that those diagnosed at an early stage have a high chance of survival, since uterine cancer is relatively easy to operate on. Number 10. Weight loss with no apparent reason. Easy and unexpected weight loss might sound like a dream for some, but not when it comes with a deadly disease. Adults usually try hard to shed weight, but if your weight obviously goes down without much effort, then it's an indication of a medical problem, and a serious one at that. Think diabetes, thyroid toxicity, parasitic infection, and worst of all, cancer. Weight loss accompanied with appetite changes is especially common in leukemia or lymphoma, both deadly blood-related cancers. Other cancers related to those symptoms are esophageal, liver, pancreatic, and colon. Number 9. An unusual lump. This should be a no-brainer, as anyone with common sense would absolutely think tumor upon feeling an unusual lump on their body. But you'd be surprised at the number of people who ignore this obvious symptom until it's too late. Anytime you have a new lump or an old lump that is changing, that is definitely something your doctor should look at. This could be anywhere, on the neck, the back, armpits, and most commonly at the breasts. While it could be something benign, like a cyst, which it most likely is, you don't want to take your chances. Apart from lumps, there are many other telltale signs and symptoms of breast cancer that women should know about. This could be in the form of an inverted nipple, unusual nipple discharges, breast tenderness, skin dimpling, or mild discoloration. Many women delay medical help as they hope it's not cancer, thinking that it would just go away. Bad move. Number 8. Frequent fevers and infections. Fever is the body's way of fighting off an infection. While it is a good defense mechanism, frequent and persistent fevers is a sign that the body is consistently being the victim of repeated infections due to a low immune system. Immune deficiency can be caused by any disease that affects the primary disease-fighting agents, which are the white blood cells. In the case of leukemia, otherwise known as cancer of white blood cells, abnormal amounts of white blood cells are produced by the body without control. While this might sound like a good thing, thinking it's not. This overproduction leads to useless white blood cells incapable of fending off foreign agents, making infections and fevers more frequent. So make sure you pay attention to all flu-like symptoms, fevers, and achiness that refuse to go away. Number 7. Persistent difficulty in swallowing. A sore throat makes swallowing not only difficult, but also painful. If you continuously experience difficulty in swallowing, don't ignore it. Several different cancers can cause this symptom, such as neck and esophageal cancers, which are regional, and also the ones originating further down, like stomach and lung cancers. Usually, people would just change their diets and eat soft foods when experiencing a sore throat without thinking much of it, but if it persists, it could be a serious issue. Number 6. Unexplained and persistent pain. Contrary to what some people think, pain is not a main symptom of cancer. In fact, most cancers start out completely painless. However, any persistent pain should not be ignored, as they could still indicate cancer. Brain cancer, for example, is the last thing anyone would think of when they get a headache. But intense and persistent ones, especially for those who are not prone to migraines, could be a symptom of a brain tumor. This is caused by a localized pressure on the nerves. Another example would be stomach pain and nausea. An upset stomach is so extremely common that no one would expect cancer in the first place. But if you're always suddenly getting nauseous, accompanied with persistent stomach aches, it's time to see a doctor. While it most likely would be something as benign as a peptic ulcer, it could also turn out to be a malignant liver, pancreatic, or colorectal cancer. Number 5. Unusual and excessive bruising. So you wake up one day with an unusual bruise on your arm, with no idea how it got there. No need to worry, you probably ran into something the previous day and forgot about it. But if bruises start appearing all the time with no apparent reason, and at strange places like the hands and fingers, and with red spots on the face, neck, and chest, then you should be concerned. Excessive bruising can be an indication of abnormal activities of the blood cells. To be exact, it is a sign of leukemia, where abnormal amounts of white blood cells cause platelets, responsible for blood clotting, to be diminished in number. Over time, the blood's ability to clot and carry oxygen becomes impaired. Number 4. Feeling tired all the time. We all have those days when we feel completely exhausted, but a good rest and sleep should be enough to recharge our energy. But if you experience persistent fatigue on a daily basis for over a month, or shortness of breath when you didn't before, then be sure to have yourself checked by a doctor. There's an endless list of things that cause people to be tired all the time, such as anemia, thyroid conditions, and even depression. Cancer also happens to be on that list, with leukemia and lymphoma being the ones most commonly associated with persistent fatigue. Number 3. Nail changes. Did you know that many diseases and illnesses can be seen in the nails alone? There are approximately 30 different nail signs that can be associated with medical conditions, including lung cancer, heart diseases, and nutrient deficiencies. Vertical dark lines are common in people with dark skin, but can also indicate a form of skin cancer. Subungual melanoma is a skin cancer that affects the nail bed of one finger. Clubbing is a condition where the fingertips become rounded and bulbous, usually seen in people with heart and lung problems. It may also be present in stomach or bowel cancer. The liver's condition can also be seen in the nails, and pale or white lines are signs that the liver is not functioning well. This could be a sign of liver failure, hepatitis, and liver cancer. Number 2. Changes in bowel habits and bloody stools. Everyone has their own regular bowel habits and goes to the toilet at a certain frequency that they're used to. But when there is a notable change for long periods, either having to go more often or less, this could be a bad sign, especially when the nature of the stool has also changed, appearing smaller, larger, or somewhat deformed. This could be a sign of colon cancer. A mass in the intestines could hinder the smooth movements of a stool or disturb the absorption of water and elements inside the colon, making the resulting stool appear different in size, shape, and color. Another thing that must be looked at is the presence of blood in the stool. This could appear as fresh red blood, or melanocytes, meaning black tarry feces, which are the result of blood having undergone digestion. Most of the time, bloody stools are something benign, like hemorrhoids or constipation, but it doesn't hurt to be too safe. If you have a number of these bowel symptoms combined, seeing a doctor is a must. Sure, nobody likes to get a colonoscopy, but it might be the only way to properly visualize a mass up there. While colon cancer is most commonly in the elderly, they are becoming increasingly common in middle-aged people. Number 1. Persistent cough or hoarseness of the voice. Everyone gets colds, and usually there is absolutely nothing to worry about, even if you feel like coughing up a lung. But when it is accompanied with hoarse sounds or blood, it's a red flag and time for you to see a doctor, especially when no other symptoms that usually accompany colds and allergies, like a stuffy nose, is present. Although most coughs are benign, a bloody or persistent one that's different than your regular cough must be examined to rule out lung cancer. A chest X-ray or CT scan would be most recommended. Jim and Diane Lake, a couple from Fremont, Indiana, would agree with this fact. One November day in 2016, they were watching the news when a doctor on screen said that all smokers over 55 should get a CT scan. Concerned, Jim persuaded his wife, who had been smoking for many years, to see a doctor, and a tumor showed up in her right lung. It was confirmed as lung cancer, and the entire mass was surgically removed the following month. If the Lakes ignored that one piece of advice they heard on TV, the cancer would have spread unnoticed until it was too late. Instead of seeking proper medical attention, he attempted to drain it out by himself while filming the process. His bicep then exploded, creating an ugly mess of blood and flesh, and he ended up in the hospital. Valentino ended up with a new nickname, the man whose arms exploded.